What is the main cause of ingrown toenails? One main cause of wearing shoes that not fit well is shoes that are too tight or too small can press the skin of your toe into your toenail. Incorrectly cutting your toenail is another main cause. Toenails that are peeled off at the edge of trim down at the corners are more likely to become ingrown. So, toenails have complex structure. There are four major parts of each toenail. The root of the nail appears as a white crescent and lies under the nail and skin. The root makes the nail and the nail bed. The nail bed contains blood vessels and nerves and produces melanin. So what is an ingrown toenail fact sheet? A toenail is an ingrown when one or both sides of the nail begin to grow into the skin next to it. So this can lead to pain and swelling. Infection can happen because of all the bacteria that hang out on the feet and in shoes. Ingrown toenails usually happen to the big toes. Do toenails have purpose? Toenails serve as a little shields that protect the skin and bones that your toes are comprised of, so that in the event of an injury, you're not left with broken skin or worse, a broken bone. In addition to protection, nails in general help with small tasks like peeling a sticker off a piece of fruit or gripping cup. So why is it good to cut your toenails? You can support your toenails by regularly trimming them using the correct tools and techniques. Proper toenail care lowers your risk of nail problems and podiatry issues like ingrown toenails or toenail fungus infection. Are thick toenails good or bad? So when contact to your health team, thickened toenails usually don't need medical care, but if they getting thicker over time or if they become painful, contact your health care team. So what do unhealthy toenails look like? Toenails that appear yellow or brownish in pigment are usually a sign of a fungal infection. Toenail fungus often begins with an athlete's foot infection underlying the nail, which then spreads to the toenail itself. So yellow coloration is often accompanied by nail thickening with a dry and crumbly texture. Are long toenails healthy? Long nails can cut into adjoining joints and this can lead to infection. Long nails are also more prone to pushing against footwear and this can cause trauma to the nail plate and lead to thickened toenails. Excess pressure in toenails can also lead to corns and callus developing underneath the nail plate, causing pain. So are hard toenails healthy? Toenails that grow thicker over time likely indicate a fungal infection, also known as onychomycosis. Left untreated, thick nails can become painful. Prompt treatment can be key to curing the nail fungus. Fungal infection might be difficult to cure and may require months of treatment. So does Vaseline help ingrown toenails? So another essential part of caring for an ingrown toenail is applying antibiotic ointment or petroleum jelly. You can then cover the ingrown nail with a bandage to protect it from bacteria and infection. So should I cut my ingrown toenail? Should you cut out an ingrown toenail at home? No. There are many reasons you should see a professional for this. So the primary reason is infection. Podiatrists are able to sterilize instruments and prescribe antibiotics if there is a chance of infection at the toe. So what is an ingrown toenail? An ingrown toenail is a painful condition where the toenail grows into the side of the toe, mainly into the flesh. It usually hurts when pressed on and sometimes show up with redness and swelling such as infection. So should you cut out an ingrown toenail at home? So there are many reasons you should see a professional for this. Primary reason is infection. Podiatrists are able to sterilize instruments and prescribe antibiotics if there is a chance of infection at the toe. At our office, we see many patients for this problem. We usually perform what is called a nail avulsion. So this means removal of affected portion of the toenail and any soft tissue that is in the way of the toenail growing out, correcting the problem and relieving the pain. How ingrown toenails are removed. So how are they removed? First, the toe is snubbed with greatest precision. We use our painless injection techniques to help make injection as painless as possible. Some patients experience some pressure, but it's tolerable. We recommend by bringing your phone or iPad to play or to distract you. How to treat an ingrown toenail at home. So after the procedure and many times prior to the procedure, we will recommend soaking the foot in lukewarm water with Epsom salts added. This allows bacteria and toe jam to come out from under the nail plate without have to forcefully remove it. You should also keep the toenail covered with latex-free cloth band-aid and neosporin cream. So this helps soften the ingrown toenail and often allows it to grow out. So if the redness and irritation are not improving, you need to see a medical professional such as podiatrist immediately. Why are ingrown toenails so painful? As the nail continues to dig into the skin, it irritates it, causing pain. So if an ingrown toenail causes a break in the skin, bacteria can enter and cause infection, which will make it even more painful. So how to prevent and treat ingrown toenails? Some treatment can be done at home. An ingrown toenail with the side edge of your nail growing to the skin can make you painfully aware of a toe you don't normally notice. As the nail continues to dig into the skin, it irritates it, causing pain. So if an ingrown toenail causes a break in the skin, bacteria can enter and cause an infection, which will make it even more painful. A red, swollen, hot, and very painful ingrown toenail is probably affected. Causes of ingrown toenails. Heredity. It can be heredity or fitting footwear and trauma. Many people inherit the tendency to develop ingrown toenails from one or both parents. Fitting footwear, crowding your feet into socks and shoes that are too short or tight can set up an environment to painful ingrown toenails to develop. So this is why adolescents and teens often get ingrown toenails due to sudden growth spurts and body changes. Teens and adolescents may outgrow their footwear quickly and can end up wearing them while before buying better fitting shoes. Trauma is occasionally of stabbing or jamming your toe, dropping something on your toe, or participating in activities that put repeated pressure on your toes, like running, soccer, or ballet, can cause ingrown toenails to develop. Improper trimming. One of the most common causes of ingrown toenails is cutting them too short. When nails are very short, it encourages the skin at the sides of the nail to fold over it. So don't overzealous with the clippers and be sure to cut straight across. Pedicures. Many women and men, increasing numbers of men, enjoying getting pedicures. Nothing wrong with that, but make sure to go on an experienced technician. Pedicures can cause ingrown nails if the nail technician is overly aggressive in cutting back to nail. Poor circulation. Adults with decreased arterial circulation are more susceptible in ingrowing toenails. So if you have diabetes, heart disease, or a long history of tobacco abuse and suffer with repeated ingrown toenails, see your physician or foot and ankle doctor. Also swelling your feet. So how to treat ingrown toenails? Sometimes you can treat your ingrown toenails at home if your ingrown toenail doesn't show any of signs of infection, swelling, hot to the touch, oozing, or foul odor. You might just try letting nail ingrown out. Soak it and wait. Remove it yourself if there's no infection. First, soak your feet in a very warm bath with Epsom salt, so this softens the skin and reduces inflammation. Using clean nail cutting tools, you can try to clip the affected area and apply antibiotic ointment afterwards. Recuring ingrown toenails. For frequent ingrown